Healthcare has generally not been is seen as more of a stepchild ministry in many countries. It's not like the biggest priority in countries necessarily spending the biggest percent of their annual budgets on healthcare. Often healthcare is suffering somewhere in the bottom. Increasingly, there have been initiatives, for example, to try and increase that, right? Try to spend 15% of your budget, whatever. But many countries spend very little on healthcare. So when you add all these things together, you're talking about sort of this ideal bad star alignment that if I throw a disease in there, basically, if you just throw something nasty in that pot, it's going to escalate in a way that in other places, you not see that kind of escalation. And then when it does escalate, we don't have the ability often to get it under control until it's extreme, right? It's that extreme. I know I'm giving you a very high level answer.
Where lust for a whole life and nothing but less makes people jump out of a comfortable pond into an unknown ocean. Welcome to that journey between the East and the West. Who says Rolling Stones don't gather moss? Hello everyone, I am Meenu Gupta, your host for the day, and I'm delighted to have you join me every week as amazing people share their incredible and inspiring life stories of straddling continents. Thank you. You don't give any importance to it. And I think that is a basic human nature, because look at the subject of death. One may not wake up tomorrow. And people want to just avoid the subject altogether. Knowing mortality, people live life as immortals, actually. So this is, I think, mental ethos. Having said that, how did you manage to create the awareness? Everything had to be built up with the resources, non-availability. You looked at what was and figured out what could be and what finally is. How did you build up awareness in the people? Because that is about mentality.
Yeah. And I know we're talking a lot about the Botswana program, which I did like 20 years ago, but I think, again, it has such good examples. So one of the things, as I mentioned, was because we came in and really assessed the situation and realized that I always say the success of any healthcare program is dependent on what you do or you do not do in the confines of your home, right? It doesn't matter what put in place and doctors, whatever. If you, in your home is where you eat that bad diet. In your home is where you have unprotected sex. In your home is where domestic violence occurs. All these, in your home is where you don't take your pills or you take your pills, right? So if you acknowledge that as like, look, the patient is most critical in terms of whether it's going to work or not, right? Then you have to ask the question, so therefore, is the patient equipped and empowered to do what is needed to stay on track? And then you'd be like, well, they don't speak English, but all the doctors only speak English. And, all these things in the way. By the way, it's quite complicated concept we're trying to explain to them for why they should take it. And in their language, you have to make it culturally relevant in their language for them to really understand why. So we knew that we had a big problem, big problem. So unlike most of the programs that I've seen subsequently, this issue of patient education or, community education, etc., it's an afterthought, right? It's like the parking garage in the mall. It's like they always seem to be like an afterthought. Like they build them all and they're like, oh, we need some parking. And then they put some parking where your car can't fit around the corners. You see all these scrapes on the wall from just inadequately designed parking. But this is an issue like that where it's always like, oh, and you will spend 99% of the budget on the doctors, the nurses, the training, whatever. And then 1%, we need to do some patient education, like a throwaway thing in there. In our case, we spend over 50% of our entire budget on patient education and community education. Designing the right tools first. And again, we took a very private sector type of approach, a disciplined approach to unpacking it, developing, co-creating the messages with those communities in their languages, testing those messages to be sure they translated. And because we had to administer this in multiple languages, right? And you couldn't actually, for example, write all the translations because sometimes there's no words, we actually went picture-based. And we developed a model whereby the people create the story. You just need a facilitator who walks them through a picture-based tool. They build a story, but it always ends up with the same messaging coming through, regardless of the language of the population who are creating the story. And we created analogies for example, in the Botswana case, we created innovative, like a flip chart. We created patient videos, whatever. We use the analogy of cattle, which Botswana is a cattle society, and that's your wealth. You build a kraal to protect your cattle. That's your immune system. And the virus was a lion trying to get your cattle. And we built on that analogy. And so in the first picture, you see cattle, and how do you protect your cattle? You build a kraal. What are you worried about? And then they show a picture of the lion coming. Oh, that's the lion, right? And so the flip chart could be used by a nurse in a clinic. It could be used in a community hall. It could be used in a church. It could be used in a mosque. And the message translated always the same. By the end of it, people have a deep understanding of this is HIV. This is what the therapy does. This is why I need to take it all the time, despite the fact that I feel well, right? When I feel well, I need to keep taking it, right? And so we blanketed the country with education at every level, from the radio stations down to these in-person sort of sessions that would be done in various settings. We recruited religious leaders across the country to say, in your next religious service, give your congregation the following messages and encourage them to go get testing. And by the way, here's who can come in to do the testing for your congregation. And ideally, by the way, why don't you lead it? You show up and do the first test and bring your congregation with you over the weekend to get tested, right? So we really went deep on that. So almost 50% of our programmatic budget was being spent on making sure that the people knew what to do and were empowered. And by the way, it offloaded the work from the nurses, the busy doctors and nurses, who would otherwise have to do this education in the context of a Monday morning queue of crying babies and people in crisis. And then I'm trying to educate you so that you take your pills properly. It just wouldn't work. So by offloading the education and pre-educating people, you more or less could almost just hand them their medications when they came in, right? And so it also cut the encounter down time way down, allowing that multiplier ratio you need of, I need each doctor and nurse seeing this many patients a day if we're going to treat the population we need to treat within X amount of time, right? Because if you didn't do that, now I had to spend an hour each per patient to do the education and do all of that, right? And by the way, there were not enough social workers to do it in any effective way, right? So communication, we call it IEC, Information, Education, Communication. IEC was priority one, as opposed to doctors and nurses being priority one. And even just framing it this way, even if I do that today, I'd probably be laughed out of most rooms, right? Because I'm not talking about the things that people want to talk about, which is doctors, nurses, drugs, the latest third line, whatever therapy, the long-acting therapy that we now have, and how we're going to roll that out. That's what people want to talk about. But they don't want to talk about, this is how we're going to prepare the people so that they will know how to they will be agents to take care of their needs forever. Because that's the most sustainable thing, is them doing the right things on a sustainable basis in the confines of their home.
So essentially, you were empowering them. And there we used the fix of marketing, where you used all channels of awareness, education, so that it understand they're empowered.
And we got above 90% adherence, above 95% adherence on a public basis, right, which is unprecedented.
How long was this? I'm very curious. From the time you started this entire package of communication, which brings information, creating awareness, essentially. How long did this process take? And I'm very curious about, because it's a crux.
It's a bit of a tricky question. So what happened was, in the country, they decided to start treatment in only 4 sites initially, right? East, west, north, south, in quadrants of the country. And that's why only those 4 sites initially for the first, I think, almost 6 months of the program. So what we did is we had to also scale up the education dynamically, right? I don't want to scale up education in a place where then you've got no treatment to go to, right? So we would activate the campaign about 6 months before launch, but knowing we're directing people to that particular site. And we also created 2-way communication channels because, for example, I don't want you to have to come in queue for 3 days because right now we can't see you, right? So we needed to also communicate to the population saying, yes, treatment's available, but don't go yet. For example, right? Get a test and you'll be tiered by your CD4 count. And then you may have to wait a bit because we have to really do active demand management, also using those communications. So then as more sites opened, as we sort of cascaded the sites to all 32 district hospitals at the time, the communication plan worked in tandem with the rollout, in essence, to be sure we're not overloading any particular site too much or raising expectations, and then you have to wait 2 years before it gets to you, kind of thing, right? So that was another thing about being very respectful of the health workers, that we're actually using this as an active demand management strategy, as opposed to simply, oh, we're just going to educate everybody, and then there's chaos afterwards because 5,000 people show up at a hospital the next Monday, and you have they'll rip the place apart if they don't get you promise them treatment. So communicating how the program works, what the constraints are, et cetera. You may have to wait long, et cetera. Really managing that well was key. So I'd say generally it was a 6-month lead up to a launch of a site to prepare the community that would be in the catchment of that site, prepare them so that once treatment launched, they would access it in the right way. And then most importantly, obviously, take the medication in the right way. And most importantly, stay on first line as long as you humanly can, because back then, already when we started the program, we started it when drugs were still probably $10,000 a year per person, right? That's when we started. So it was important not to go to third line back then, which would have been like 40, 50,000 a year per person, right? So that education was really important of how do you maximize your first line so you don't end up on additional lines of therapy, which at that time weren't affordable. Now they're much more affordable, but even then you still don't want to exhaust them too fast, given Africa has basically the largest proportion of HIV on the planet.
Okay, that is the point. I've been wanting to ask, why? Is there a reason for that?
It's a hard one, right? I think, if you look at it, the simple thing is, if you had a deprivation index, right, of places that have the worst problems on the planet, worst poverty, worst, Africa usually ranks high. And so it will rank high for all these other things. In essence, all of the social determinants of health are working against you in those environments, right? From education, lack of income, i.e. poverty, gender dynamics, social cultural issues, right? When you add that all together, right? And then on top of that in Africa, add in the fact that you've generally not had very functional public sectors who the majority of the population are dependent on. Healthcare has generally not been is seen as more of a stepchild ministry in many countries. It's not like the biggest priority in countries necessarily spending the biggest percent of their annual budgets on healthcare. Often healthcare is suffering somewhere in the bottom. Increasingly, there have been initiatives, for example, to try and increase that, right? Try to spend 15% of your budget, whatever. But many countries spend very little on healthcare. So when you add all these things together, you're talking about sort of this ideal bad star alignment that if I throw a disease in there, basically, if you just throw something nasty in that pot, it's going to escalate in a way that in other places, you not see that kind of escalation. And then when it does escalate, we don't have the ability often to get it under control until it's extreme, right? It's that extreme. I know I'm giving you a very high level answer, but if your simplest answer is the social determinants of health in Africa are stacked to deliver the worst of the outcomes, no matter which disease you talk about. So that's why we have some of the worst diabetes on the planet. We have some of the worst infectious disease situation on the planet. The one where I think the Western world outcompetes us is cardiovascular disease. But even that's, as Africa urbanizes, that's catching up, right? With urbanization, we get all the Western profile of disease as well. But for example, I think South Africa some years back was ranked as the third most obese country in the world. I don't know what the current statistic is, but these are the kind of things that, like I said, all these bad things come to roost, right? It's like the ideal soil, right, for these things to really take root and wreak havoc. And in many African countries, you find these environments that allow that because the social determinants are all usually wanting and therefore leading to these risks.
And when the Botswana project, if I had to call it that, landed on your plate, you were at that time in McKinsey. At that time.
So when the project came up, it was initially pro bono. So in McKinsey, what happens is certain projects come up, you'll see them on the computer, these are the projects available, and you'd have to bid for projects that you want to bid on. And so sometimes the owner of that project, if they see your particular skill set within the firm database, might ask you to be on a team because you have a unique skill set. So in this particular case, when they saw my skill set, they asked me to be on the team because I had an MPH, MBA, clinical background, and asked if I'd be on the team. And so that's how I ended up joining the team to do this pro bono strategy engagement. We went down, did that for 3 months, but we were based out of the Johannesburg McKinsey office, and we'd fly in and out of Botswana for 3 months doing the strategy. And then I went back to my New York office, and a few months later, very soon after September 11th, actually happened, I got the call saying, hey, are you willing to resign and come and help be the operations manager of the program because we're struggling? Because when we left, we thought, okay, now they'll have to implement it, right? And then when I got back, realizing, oh my gosh, whatever we had given them was not going to work. Took a strategy document and we're trying to implement off the strategy as opposed to create an implementation plan first and then implement off the implementation plan. So I had to come in, retrofit an actual implementation plan. We literally called it the Bible of the program, right? And I said, I want this on every desk in every ministry. Everyone understands what we're doing. These are exactly the steps we're trying to take. Socialize it, get it into the lexicon that this is what we actually are implementing off of, and then start to actually implement it, right? So I showed up. I resigned, jumped on a plane, went to Botswana. And like I said, I was there to initially just be to assist the person running the program. But then he ended up leaving the program and I was asked then to take over and run it. So I ended up in charge of this. I'd gone there to be like a 1-year assistant and then ultimately was told, look, you have to take over running the program. So what was supposed to be 1 year ended up being 5 years of really making sure this thing got true anchors in terms of countrywide rollout.
That was what I was going to ask you. From the time it was destiny, I think, when you ended up there, unless you say otherwise, you ended up there. From that time, and it was approximately 5 years where you could look back and say, there is impact, it's happening. Is that so?
Oh, absolutely. I mean, we saw impact, I'd say, in the first month of the program. I'll be honest. Because remember, when we're starting treatment in the context of no treatment before, right? So people were dying like flies. I mean, literally dying like flies. When we'd open a treatment center, I mean, in some cases, people would bring their loved one to the hospital and they'd be so sick that they would die on the ride to the hospital. So people would come in, I remember one lady had a TB abscess in her brain the size of an orange, right? And a CD4 count of 0. We had many people with CD4 counts of 0, 1, 2, right? And we're like, we can't say we're not treating you. So we're going to try to treat you and we'll see how this experience goes. Now, they're very resource intensive to treat because they're so sick when they come in, right? They're basically ICU level patients who take a lot of time from the research. So it blew our staffing projections out the window. We thought a doctor could see this many patients an hour. I mean, you'd spend your whole day just seeing 3 patients because of how sick they were, right? But we noticed after a month, you've been treating them, they live and they get better, right? 90% of them lived, even with CD4 counts of 0. Even with these, they'd come in as horrific trainers, literally weighing 32 kilograms, 28 kilograms, an adult. And you'd see them 6 months later and you don't recognize them when they walk in. So it worked. So very quickly, within 1 year, I think we almost stopped all HIV deaths in the country. Because remember, they're bringing in the very sick who are about to die, and we're treating them. So within 1 year, almost brought mortality to a halt. So impact was very quick in that sense of the work because of all sick people work.
But that is phenomenal.
It's absolutely incredible. But more so, in a way, it was also because there was a debate of someone that far gone, should you even waste the treatment on them? And the answer was actually, if you can just figure out how to get this scaled up fast enough, even though they're very intense, they live. And 90% of even the very sickest live. So with that insight, we're like, okay, we have to figure out how we treat everybody. We can't say, you're too far gone, we're going to not treat you. We have to treat everybody. And so we have to be very creative again on how we did that. Because as I mentioned, for example, we opened 4 centers And everybody went to those 4 centers. The queue. So what happened is on each day, when the doctors, rightfully, when they come out, they say, who's the sickest? And then they treat them first, right? So what happened was, if you are not that sick, but HIV positive, let's say my CD4 count was 10, right? Which is horrifically bad. But there's somebody else with 0 who can't breathe in front of me, right? Who has pneumonia and can't breathe. They will get seen. But because there were so many sick people, I would have to get that sick before I got to the front of the queue. So what got you to the front of the queue was you being the worst on that day, right? And by the time I'm the worst, now I require superhuman effort. I require a big team working on me. I'm an ICU patient in essence. And we're like, this is going to collapse our program. We're not going to be able to scale up because it's killing our resources. And we're barely getting enough people in because the few we get in, yes, they live, but they're using up all of our resources. I remember thinking from my MBA class, we had this case study of Disney and how they manage queues, right? And so I was like, let me go and refresh on how does Disney manage its queues. So I went, looked it up again, unpacked like, okay, these are the most effective, from a queue theory point of view, these are the most effective way to deal with it. So what we did is we split the queue. And we said, on some days, I will reserve for all comers and do the normal. But some days, I only go and pick off people from the queue who aren't yet at death's door, who are still ambulatory, not in a stretcher, not in a wheelchair, whatever. And I can enroll for every 3 of these, I can probably enroll 50 of these people, right? On those special queues, from those special queues. And by having that special queue, we're able to do the volume really quickly by getting in people who are, and remember, they're pre-educated, so I don't have to spend that much time on them, roll them in quickly while still allowing enough capacity to treat the very sick. So that's how we address that. So this is what I mean by injecting, again, some of these practices from completely what you think as non-related industries. But I want to say, if you have a problem with queuing anywhere, and you have a problem now with queuing with patients, you can learn something from industries who are the best in the world at figuring out how to manage queues, right? And so that's one thing that really did help in those early days, because otherwise it would have been stuffed, because we could not open the next clinic fast enough to bleed off the demand. But we were able to actually, I think by the end of year 1, more or less able to get all of that initial bolus of hyper sick people treated. And then we more and more started to see people who were not that sick. But believe it or not, I think it took over 5 years or more even, to be honest, maybe even 8 years, to get to a point where the average CD4 count when we diagnosed you was above 100. And 100 is low, right? But it took that long for us to start seeing people who were, again, relatively well, truly relatively well. Even though they were ambulatory, they were still really, the immune system was shot. So it took that long. And by the way, it's the same experience in most of the other countries we've worked in. We worked in at least 30 other countries. Same story in terms of only kind of almost now, 20 years into treatment, where you more consistently see people come with CD4 counts of 500, 400. But otherwise, for a very long time, you're just seeing still people, in essence, being driven to care by illness, not driven to care because, oh yeah, I'm just worried. It was still initially a very illness-driven model where people had to feel something was off before coming in. And in that model, like I said, it's more intensive, more expensive, more resource draining when you're dealing with sick people as opposed to well people who never needed to see the inside of a hospital.
And how long did you stay there? So how did you feel? Did you at any point in time feel overwhelmed?
I didn't have the luxury to feel overwhelmed because I think there was just so much at stake. But you know how it is where when you get into the zone, right? Whether sometimes like you're struggling with a paper and then you just get into the zone and all of a sudden it just flows, right? And you can do it. I mean, I got into the zone and it was like I knew what to do. I knew how to do it. And it was just this being literally in this zone where almost like I was impenetrable. You know what I mean? Like I could see all the angles. I could see all the connections. I could see all the interconnections. And I, at any given point, was like 100% knew what to do and how to pull it together, including the politics, including this and all the different, elements of the orchestra that needed tending. I was just there in the zone. So I didn't really have the time to feel overwhelmed, probably felt the effects of it after Botswana, where probably burnout, probably was definitely, I think, burned out by the end of it, for sure. I can objectively tell you that. But while I was doing it, it was just like, this has to get done. And failure is not an option. That was, in fact, part of our one statement. We'd always say failure is not an option. because we knew what was at stake. We knew, in essence, how, at least initially, there was a lot of people gunning for us to fail, to say, see, we told you so. We told you not to do this. And we knew the impact that would have on the continent as a whole if we failed, right? If we had failed. So at least we knew if we got it right, not that it necessarily meant the whole continent would now scale up necessarily, but we knew if we got it wrong, it certainly would be an excuse not to scale up treatment in the rest of the continent. So that also was an underlying thing. And I tend to work best under pressure. I'm one of those, when the worst pressure puts me in the zone, right? Then I get really in the zone. Right?
No, I understand that, because then you operate from a certain level where, so somebody says, what are you feeling? So I totally understand that experience. Now that you're not in that particular zone, at that age, what did that teach you about leadership when lives are at stake, in your words, and failure is not an option?
Well, I think the interesting thing for me from that experience was almost, in essence, one of the things I did not appreciate at the time was, in essence, how well the stars had aligned to allow me to do that in that way, right? To have a minister of health who would see the potential in this young Ghanaian American guy and give him this kind of opportunity. To have Merck and Gates provide really substantial funding to support something like this at a time when most organizations would give you $200K here and there, and these guys were providing $100 million basically to drive this experiment in Botswana, right? Which is unprecedented again at the time, right? So, and then, like I said, to work with a president of the country, by the way, who would face down detractors, and he would argue with people who were trying to basically stop us doing various things, right? We even had a whole lobby trying to stop us from testing people. It was craziness. And the president would literally stand up and face these people down. So having that kind of ecosystem alignment, I didn't appreciate it as how important that was. Because after Botswana, then I ran head on into environments where none of those things were optimized, right? So it almost became like Botswana, you were allowed to do, I know it's a really bad analogy, right? But I was allowed to do just complete ground warfare and deploy everything. And then after Botswana, it became, you had to do guerrilla warfare, door by door, house by house, that kind of difficult grinding, because so many of those other things are not aligned, right? Because half the time the donor is not aligned with the country, then the country, they're not aligned with what you want to do. It was so much harder, right? In terms of trying to repeat that in the same aggressive, we're just driving this project and I can see start point, end point, and I can connect the timeline. In other countries, it became much more okay, these guys are going to take 10 years now because I start working with them from this point, right? Occasionally, and then you find at a sub level in the country, one district, there's a manager or a leader who really gets it and you can do amazing things with them. But rarely would you find that at a country level again, where the whole country is mobilized in that way. Now, the one place I know in Africa that's like that is Rwanda, because from top leadership down, they've built that culture of innovation. They've built that culture of performance. Ministers get fired for not performing. They literally run the country like a private corporation. But in most other places, it's working through the same issues, except much less alignment, much less support, much less coherence among these factors. And so my biggest lesson from there was, and this was a big humility in a way of realizing, I didn't realize how lucky I was to have those factors in place until I got into now other work where these factors were not in place, right? And then most of the last 20 years has been, dealing in places where a lot of suboptimality. South Africa, the first district we were given to support, they were the first to achieve the triple 90 in the country, right? And that was by the way using technology and AI at a time when nobody else was using it. So we started using machine learning and natural language processing in 2014 and creating a system that would inform managers of exactly where their 80-20 of their problem was. These 5 clinics are causing 82% of your problem in this indicator. These are the issues. And if you do the following things, you can change it by this much in this time. And that being delivered proactively to them, those insights on a dynamic basis, having nerve center and leadership teams where they're using this data to direct their resources to where the problem is and getting remarkable turnaround results. So like that district became the first in the entire country. And that, by the way, that district is the ground zero of the global pandemic. It is the worst, most affected place on planet Earth on HIV. And they became the first to hit triple 95 using some of these. So we've been able to get some breakthroughs, but it became much more of a find the right district, work with that district team. But at national level, and same as Botswana, not able to really repeat that because in other countries, it's, again, a whole different set of dynamics you have to deal with.
And because this is actually all those years with the circumstances you mentioned, with the diversity, with the culture, and with everything, with the situation, tremendous pressure. Sounds like more than a 48-hour job in 24 hours. How did your family take that? Or were you there with family?
So on a personal level, obviously, my life was not really compatible with having a family, right? Honestly, in those days. I got married at age 46. Right. So well after Botswana. But I don't think so. I mean, if I had had a family, maybe it could have worked. But I think just based on starting the company in 2003, finishing up in Botswana, then moving briefly to the US to set up our offices there, then moved to South Africa to run the program, to take over from my business partner who had set up in South Africa. And then he moved back to the US. We swapped places. I came in 2006 to South Africa to run our work here, and then a lot of the other Africa portfolio of work we're doing. So a lot of those early years were just a blur, and a startup, traveling 90% of the time, working across multiple countries. We had a project in Vietnam, we had a project in Eastern Europe, we had a project in the Caribbean. So a lot of that, in essence, it worked that I didn't have a family. But then when I got married in 2016, it was a different time. Like we didn't have a CEO per se. We got a CEO in 2019 finally, but like a real group CEO, and it wasn't founder run at that point. But we were much more stable. We had teams and executives and things like that. So it made it a bit more livable from the point of view of a personal life. But it definitely was an all-in element that, for example, in medical school, I don't know how some of my classmates who had families made it through medical school, right? With being in the hospitals and the wards. So I guess it could be doable, but I think in my case, it definitely did, I think, delay some of those things for me in terms of the kind of the maniacal commitment required to pull off some of these things. So I remember also saying, for example, like the Botswana experience, but in retrospect, I was like, I think most human beings would only have one of those in them, the ability to do one of those in a lifetime, to do that in terms of the energy and the commitment and the drain that it will put on you to do it. It's not for the faint-hearted. It's not standard plug-and-play stuff, right? You really have to. It's like becoming like a character actor, and you're going to hold that character for the next 5 years. And you know what I mean? It's like it's all-in commitment, right? I can't explain it in any other way. So I remember thinking like, I don't think I'd have another one of those in me. If somebody said, go to another one, right? I'd be like, I don't think I could do it. It needs a younger person with much more energy and much more naivety than me to go do that again. Because there's a good element of also not knowing what you're truly getting into in order to get into it. And now I think also having been around the block for almost 27, 28 years in public health in Africa, I also kind of know a bit too much now as well in terms of like, there's just some stuff you're not going to get there. It's not going to work, right? And because I know the environment too well. So I wouldn't sign up for that again at this particular point. But I definitely love working with people who are at that point in their career where they're taking on these kind of things. And to the extent that I can really help them to shortcut things or, in essence, accelerate better than based on the lessons I've learned, I definitely really enjoy doing that a lot because I think there was very few people to really help me when I was doing it. There was a couple of people who came to the fore. One I'd like to mention is, for example, Joop Langer. He was the founder of Farm Access. Unfortunately, he died in that Air Malaysia flight that was shot down. He was a juggernaut of public health. And for whatever reason, he found me in Botswana all the way from Amsterdam, took me under his wing. In terms of growing me as a public health professional, I owe that largely to him. And he took me under his wing and grew my profile and made sure I presented my work on national stages. The high point was the Paris conference. I forget which year it was, but I had the keynote address just before Mandela got on stage. And he worked with me to get me ready for the big stage and presenting in front of 5,000 people. And he was somebody, for example, who was like, my whole life, I fought for treatment in Africa. Nobody would listen, and the fact that you're doing it, I'm going to support you, right? So that's what I try to really focus on now, is finding those doers who are, in a way, doing what I was doing, right? Trying to get really unique breakthroughs and then saying, hey, can I support you in some way, to do better, whether it's by linking them to funding or helping just advice or being a shoulder to cry on or using my network in any ways I can to help them also do better. So more and more now I focus on that. And then of course, supporting my team who are doing various amazing projects and groundbreaking projects still. But it's getting to that point where it's more about, like, I'm also big on often us older people overstay, and we don't let go, early enough and let the younger generation actually grow. And early on in South Africa, for example, I made my deputy CEO and then I reported to her. So she'd learn how to be a CEO. But I think often, and particularly now getting to this age, I'm like, even more so, it really is about growing other people who I think are going to take things over the line. And I'll still make my contribution.
How is it? So it's in this trajectory of life, of which I only touched on one project because I got so much out of it. And I think it was the foundation stone for you as a human being, from what I see. Or you brought yourself the foundation of what you are as a human being. You brought yourself to the foundation of something else. And it's literally a child that you births in nature.
Yes, exactly.
I totally agree with you. With that level of commitment, nothing else is possible. That is it. And that is everything. There's nothing else. As that is of that level. And how do you feel? Because there are two worlds, the inner world. In the outer world, what you did and what you achieved you that level of recognition. You were in the Obama's advisory council. How do you feel inside? I must say you were very lucky.
So for me, I'm a very deep introvert, like horribly introverted. So I don't enjoy presenting in front of big groups. I don't enjoy big buzzy things, right? Like I've always been more about, I like the few people who, the way I put it this way, if you really, really want it done well, call me, right? If you really want excellent work, you call Ernest, right? But I've never been about being popular and known. Luckily, I kind of missed that social media wave. And when my Time magazine piece came out, it was pre-social media. That was like 2005, 2006, pre-social media. And so for when you say how I feel, so there's an element of almost like, I hate the limelight. I hate the buzz, but it has given me opportunity, right? It has given me a voice on a stage and in places where normally a deep implementer's voice would not make it. You know what I mean? And so I'm very grateful for that. So in a way, I feel extremely, extremely grateful for what I have. But at the same time, there's always this element of, I think my introverted nature is much more like, I like doing my work, keeping my head down, doing the work and the social media stuff. My team is always, Ernest, why aren't you posting more? I'm like, I don't really enjoy it. But to my team's credit, though, I think they're right. Because one thing I'm also realizing is to see the number of people who come in and take credit for stuff you did, that it's just shocking. In a way, I'm like, yeah, maybe I've done a little bit more of putting things out there, in particular on behalf of my team who did the work in Botswana, because I feel they never got the recognition they deserved. And all these other ones, in particular when PEPFAR and Global Fund started, all these other entities who then came in, all claim the credit for this stuff. But everyone forgets this little intrepid team, who did the work, right? And really set this thing up and really made the sacrifices. So in a way, I agree with my team, like, yeah, I should put myself out there a bit more, But I've always been more around, I like the people who really, like, when like a musician would say, that's an artist. I want to be the public health people's public health person. I don't need to be widely known, but I like it, the people who really are at the core of public health. And it was good, for me, it was great to have that professional validation. And maybe that's the selfish ego part, that's saying, yes, It's nice to have that validation, but I also know I did a good job, and I knew I did something that was unprecedented. And so I felt, that recognition by the expert community that, hey, this is somebody who really is a transformer and can really get things done and also brings that truth and integrity to the table. That matters to me. I feel extremely fortunate. I always say I grew up, my parents were university professors in Tanzania, and I grew up middle class, but we were poor if I compare myself to what middle class should. I mean, my parents' combined salary back then was like $3,000 a year, right? So couldn't afford college. I take out loans and all of that. But at least I'm fortunate enough to be in a position to take out loans. You know what I'm saying? I grew up in Tanzania at a time where there was often no running water, no electricity, no petrol. I remember you'd have to bribe the storekeeper to keep you bread. And by the time you'd get the bread, it would be moldy. And I remember my mom having to meticulously try to cut out the worst bits of mold, and then she'd toast the bread to make it that hard toast, and then that's what we'd eat, right? So yes, we're growing up middle class, but you'd have heat water on the charcoal stove and then mix it in your bucket to have a bucket bath. So for me, I'm always grateful for small things. You know what I mean? Like grateful for the fact that, for example, I can have a warm shower, I have a roof over my head. I can more or less buy any book. I can walk to a bookstore and buy a book that I want to buy and not worry too much. I've got food for my kids. They can eat decent food. I can put them in decent schools. That's enough for me, right? That's enough, more than enough. So I think for me, when I say I feel grateful, I'm like, I just feel all the opportunities I've been given, all the people like Europe, people like Eric Gooseby, one of my old university professors, what's his name again? This is my biochem professor who let me stay in his house, when I couldn't afford stay in the dorm at University of Wisconsin. All these people who sort of have really just been kind and reached out and helped me along the way. Oh yeah, Alex Coutinho is another one who was the former founder of Tasso in Uganda, who took me under his wing and advised me. And these are people who I just feel like I've had a charmed path, you know what I mean? And to get to this point where I've been able to have decent professional accomplishments and recognition, to have an amazing company, and to get to wake up and work with amazing people. Yes, horrible difficulties you have to deal with on a daily basis, like horrible issues. But at the same time, I usually say people would kill to be in my shoes, right? People would kill to have my problems, I put it that way, right? So for me, there's always this overwhelming sense first of gratefulness, right? And then there's immediately beneath that gratefulness is okay, there's a lot of shit that needs to get done. now that's good. What am I tackling today? Like, what's blowing up that I need to address? What issues, what dragon needs to be wrestled to the ground, right? And just very much doing that. And often spending so much time that I don't step back and appreciate the stuff we've actually accomplished, because there's usually another crisis that needs to be addressed. Once in a while, with my co-founder, John, we do have a chance to sit back and be like, yeah, man, we set out on a very different path than many people. And we've done it. I mean, we've really done it, and we're still doing it to a large extent. As obviously getting to 55 makes you also just reflect on, do I need to still do more of this? Or is it much more, to me, it's much more about elevating others now who can really do it, like who can give. Because if I could find the 31-year-old version of me, who's 31 years old now, and help them to be more amazing than I was, hey, then I think the world will become better. As opposed to me trying to still make it about me in some way, you know what I mean? So I think if we're not going to get it right with more people who can go out there and really be transformers, I think we're going to be in big trouble, because the world badly needs that right now. And with all the stuff going on, in particular now, we really badly need a new crop of leadership who come to the fore, who are healers, who can build bridges, who can solve these problems. I think if we're going to have any hope with the big things that are facing us as humanity at the moment. To me, it's more important to know what you don't know than to know what you know, right? And I think if you really are good at investing in knowing what you don't know, it literally makes you the most powerful person in the room, right? Because if you know you don't know it, you know that you need to find the person who knows. And then you can bring them in as part of the team, and you can build really effective teams and coalitions or whatever is needed, right? But when you think you know it, then you often get it wrong because there's blind spot stuff that you should not be messing with, and yet you'll try and mess with it and not bring in the right expertise to actually deal with that thing effectively. And I think maybe naturally, like growing up, I was always like super curious about so many different things. I had a hard time selecting a major in undergrad, as I did 3 majors. I was like so interested in so many different things. And I was like, will there ever be a job that pays me to be interested in all these different things? But what I didn't realize is that being interested in all these different things, I don't become experts at those things, but it just teaches me enough that thing exists, and I know it's there, and I know that I don't know it well enough, right? But I know that when I recognize that it's needed, I can find somebody who can bring that to the table. You know what I mean? And so, yeah, exactly. It nails me to connect the dots, right? And I remember once being in a train somewhere and hearing these 2 people talk about cryptocurrencies. And it was like such an advanced, fascinating discussion listening to these people. And I was just like, I know nothing about cryptocurrency. But having heard this conversation now, if I do come across a situation that needs somebody who needs to address this thing, I know I need someone like that. You see what I'm saying? Right? So for me, it was like, okay, now that's how I'm always like, even my wife just always laughs at me in terms of like, I'm like reading quantum mechanics and whatever for fun. But I'm like, I'll never be an expert. I can barely understand half of what I read, but I know it exists. And I know just enough about it to know that when I need to find an expert in that to be brought to the table, or there's an analogy from that applies to my world that can be used, then I know I can go find an expert, sit with them, present my healthcare problem to them. They can provide that knowledge, apply it to my problem. We can maybe co-conceive a solution that nobody had thought of before.
Yeah, and you're wise enough also that when you know that you need to go deeper, you will also go deeper, because I found what I found very relevant, which was right at the start when we started. When you asked that question and then you decided to do management, because you knew that you had to go deeper to be able to, and actually all those things served you. Your medical background, your systems learning, the management, all served you, all enabled you and empowered you to do what you had to do.
Exactly.
Literally your calling.
Exactly. I've always been driven by, I always say, how do you feel when you wake up in the morning? Is it easy to get out of bed, or are you dragging yourself out of bed to go do whatever? I always say, if you feel that sense of like dread in your stomach, or I have to really drag myself to do it, you're doing the wrong thing. And I've always just operated by that sense of feel, to know, am I doing the right thing or not? Like I feel my way there, as opposed to logic, or, I'm doing well in this class, or I'm scoring 98% in this, whatever. So that's always been my guide of, at a gut level, how do I feel? And then I trust that when it feels right, I'm in the right place and doing the right things. And when it stops feeling right, it means I need to make a change. And I think that's kind of served me well over the years, in terms of when I got to those points where I'm like, this just doesn't feel, it's just too difficult to get out of bed in the morning. And I'd say since leaving for Botswana, I don't think I've had a single morning where it's in the last, 25, 26 years, where it's been hard to get out of bed to go do this work. It's not been difficult at all. I genuinely enjoy it. I read this stuff for fun. It's not a put on thing or drudgery or whatever. Being able to get a meaty problem and work with the team to solve it. And I definitely, your word is calling. That feels like my calling.
It feels so. And what I do see in front of me, and do correct me if I'm wrong, now that I've analyzed you. At the age of 55, or at the age of 50, when I understood, and that's when I stopped what I was doing and moved on to another field, I realized, and I think I've gone through many avatars of myself, done multi-industrial, across sectors, continents, and that's when I suddenly said, I need to do more. And so I really want to do more, but I will take of what I've done to do that more. And I realized everything, whatever, marketing, management, whatever I did, was all about a story. It's the story. I remember, and that's the reason I was very curious when you said about how did you transform the lives of those people How long did it take? What did you do? And you were telling a story. You were changing their story by telling a story, by first understanding their story. So it was all about the story, and your life in your head is also a story. And I may ask you your story another day, and today you've shared one version of that story.
That's, yeah, definitely one version.
Yes. So a story is never complete.
I apologize we couldn't get beyond Botswana, but I think it was very foundational.
Part of my doing. It's always a dynamic. I have 4 pages sitting in front of me, of which I didn't go beyond the first question because I realized, and which I always do, you led me to that first question we were talking because this was so interesting. I hope you will also do another session with me for the rest. But coming back to the story is the fact today what we were talking about was also a combined story. And the day I understood 4 years ago, I sat up and I said, oh my God. And that's when I decided to do something else with story, with a complete different thing. And I'm so glad. Thank you for sharing this part because this is so amazing. And I was trying to dig deeper and deeper because, for example, you are mentoring people because that's what you want to do. You want to be able to share that, to be able to be useful for other wonderful young people. I'm amazed at the youth nowadays, by the way. God, I used to think that generation. Now I think, oh my God, yes, that generation.
Yes.
So
I've met a few of them, blown my socks off.
I was completely, because I spoke to them, the people from war zones and peace building, and I have been amazed. I've learned a lot. And at 31, I thought I knew a lot. And I've meditated for that many years and so on. But the older I get, I understand because my world becomes bigger. I understand the older I get is I know less and less. I don't have to know it all. But what I need to know, I know. That is important. But it all becomes a story. And I'll wind up with that.
And I'd like to thank you for doing this and helping to tell stories because also for me, looking back, I remember I mentioned us not telling certain stories enough. And I think that was a missed opportunity from our side as well, because to me, where I've arrived at now, looking back, is we really need to change mindsets. That's what it's about. It's not about another shiny tool or another product per se. It's much more important to change minds and hearts, what we think, right? So for example, take the situation about aid and aid dependency and whatever, right? That is a mindset issue, right? And that has to change fundamentally. It's very hard to do anything good when that's the persisting belief structure, right? Which is basically in unsustainable models, and somehow you think that's going to work for us. And I've been questioning myself of like, yeah, have I been enough? Have I done enough to help change those minds and hearts around these things? And I think what you do is getting right at the heart of the matter, what's needed most right now, is people you need to change, and they change through stories.
Absolutely.
That really.
And this has been happening, and that's why I said so dynamic. I was going to say something about head and heart, and you just said that. Because what I realized about stories and about changing mindsets, even with similar experience, small example, I remember many years back, there was a Spanish government, a collaboration. I signed up, and they told me, Minu, we would like olive oil to be in the food of people. And in India. And at that time, olive oil was not in the food of people, it was on the skin of people. So they were using it as cosmetics, or when they went out, it was never in the food. Traditionally, olive oil comes from that country, maybe in a 5-star, and it's on a salad, and that's it. Getting into the food of people is it's like meddling with the taste of a nation. Changing a story. So first I told them, I've never handled my hand, but I would love to do it because this is what I do. And I loved it because I work with passion. In 1 year, it went up by 400%. And all we did, Ernest, was exactly that, the mindset, the awareness, the story. We changed it very mindfully and very subtly. without coming over the top and shouting at them, and you have to do this. This is the best. I used all the influencers. So I actually used doctors, by the way, from cardiologists and nutritionists. I think I used all those people because I did exactly what you did. You told me that the life of the people is in their homes. Everything, the domestic abuse and everything what they are doing is in their homes. Similarly, the people I'm trying to affect, what do they do? Where do they go? Whom do they listen to? What is their everyday life made of? And all I did was get into their everyday life.
So you're a fly on the wall.
Yes.
You're a fly on the wall, right? Yeah.
And that's all I did without them even knowing it. Even in restaurants, because I knew the mindset was, if there's olive oil, it's going to taste different, it's going to be like this. So I actually provided them that to the restaurants, told them, don't do anything, get it into the food, and after it's eaten, go and ask them. And you had these shocked expressions. Oh my God, that was lovely, but really? You use something else? So we went through this whole thing, psychology, and I realized over time, and this is also my meditation practices, were all about the twin heart, the mind and the heart. And emotions and the feeling and the intellect, they have to come together for anything of any impact to happen in your life or anybody else's life.
Because you're changing conditioning, right? We know how difficult that is, right? It's neurolinguistically wired, literally at a biophysical level into people, right? Into how stimulus response works in us, right? And anything that goes against the state of conditioning will elicit my fight or flight, right? Just at a biological level, literally. And so that's to your point of being that fly on the wall and figuring out how to really seamlessly integrate. So yes, I'm changing things, but I'm not going head on against the conditioning because that's what leads to the fight or flight and whatever. But I figured out to massage it so that it comes in and it's like after a while, it's like, oh wait, I've been eating olive oil and loving it for for this long, but I didn't come in head on. You must eat olive oil here. Here's a cup, drink it. It just backfire badly, right? And as I realized, at a human level, that conditioning, but systems similarly get wired that way.
You get into a box.
Trying to change the system.
The society builds you into a box. And that is something I would love to change the next generation because everything has been put in a box. And of exactly what you did not work in the box. You worked absolutely out of the box. You built, you created. And that's how inventions happen. That's how anything of any impact happens because you didn't sit there and believe this is the way I work. This is the process I follow. This is how it is done. Again, coming down to simple bare facts, connecting dots, it's about the mind and the heart affecting the emotions, the feeling, awareness, and just giving them another pair of lens. I've realized one thing in life, be it any field, you give somebody another pair of lens or just shift. And we're always looking at a picture. This is my picture because it is in front of me. But however, I'm only seeing one part of the picture. If I just move away, use another pair of lens, multidimensional, or I borrow somebody else's, or I just be open and listen to somebody and he says, I also see that in the picture because I'm standing there. That's a more complete picture. And there is something you said about all the data and stuff you had got at McKinsey. In my conclusion, all these years has been, and I've seen that over time across industries, data tells a certain story, but it is a very partial story. You need a human being to complete that story.
And as I found it over and over, the story is always with the humans.
It's all about...
You have to, I would say you have to have your operational plan, then you have to have your human plan. How you're going to basically address the humans who are the ones who are supposed to play in this sandbox you're setting up or in this landscape you're setting up. Because all
always
end up being about human dynamics, right, at the end of the day.
At the end, because I know that when I went from one industry to another, whenever there was data, I would talk to people. Before I built any, I did similar observation, talking, understanding, and then came a larger perspective, an aerial perspective, because they were all in their box, and people sometimes within their industries get very competitive and they don't talk to each other. I was from outside the industry, they would talk. And I would bring in another industry perspective, and from an aerial view, I could suddenly say, oh, do this, this, and this, connect the dots. And 5 years back, I realized, okay, it's all about a story. So instead of doing that, I decided to do this. And I would like to say thank you for sharing
Thank you for
yourself.
having us. Said I try usually not to be found.
No, it was.
So thank you.
So it's so wonderful. I'm so glad that you came.
Oh, my pleasure.
Thank you for listening to the series Between the East and the West. Do subscribe to the channels mentioned on the site in case, of course, you liked what you heard. I am Meenu Gupta, the host of the series, and I'll be looking forward to your comments. We love feedback. Thank you once again. Namaste and bye-bye.